Hello everyone, my name is Andrew. I'm the pharmacist with Rapid's Family Health Team. First of all, special thank you to Rachel, Alexa, and everybody at the Family Health Team for putting this program together. Today our presentation will be about fall prevention, osteoporosis, as well as treatment and prevention. 1 in 3 seniors will experience a fall every year, and 40% of these falls will result in a hip fracture. That's quite a high number. Um, Most of these falls actually happen at home while people are about doing their daily activities. Um, to fall is not a normal part of aging or getting old. If we understand why it happens, we can help prevent it. The reason people fall uh, is usually a low blood pressure, low blood sugar, decreased vision, decreased muscle strength, or medication, something that makes them drowsy when they take it, or environmental, something like wet floor, ice, a rug, or a power cord, and finally, osteoporosis. So today our learning objective is to focus on osteoporosis, how to prevent it, and a little overview of treatment options with prescriptions and preventative options with over-the-counter medications. We also will talk about over-the-counter medications that increase the risk of falls. First of all, what is osteoporosis? It is a disorder that makes your bone more fragile and prone to breakage. Bones are living tissues, and it is always going through stages of remodeling. Bones consist of two types of cells, osteoclast and osteoblast. The first one gets rid of the old bone, and the second one helps in building new bones. The osteoporosis or low bone mass occurs when a balance between these two types of cells is disrupted, leading to a net loss of bone, which means as we get older, the one that's building new bones slow down, and the one that's getting rid of old bones keeps working. Why is it important to prevent a fracture? Most people aren't actually diagnosed with osteoporosis until they break a bone. And when someone has a low bone mass, even a minor fall can break a bone. This is called a fragility fracture. And once you've had a fragility fracture, you're at more risk of breaking another bone. And as we get older, we're more likely to fall backwards, landing on our hips. And in that case, there's loss of mobility. You can't get back to your normal daily activities as you used to, and you may never go back to your previous walking ability. So who's at high risk of osteoporosis? People 65 and older, females, family history of osteoporosis, high alcohol intake, smoking, increased caffeine intake, more than 4 cups a day, low body mass or low body weight, medications, prescription medications like glucocorticoids, uh, pioglitazone, PPIs, SSRIs, and anticoagulants. Um, Serotonin reuptake inhibitors, these are the SSRIs. This is a class of antidepressants. PPIs are a class of stomach pills, and glucocorticoids are steroids. Medical conditions as well, uh, rheumatoid arthritis, and increased thyroid gland activity. Some medications can increase your risk of falls, and certain medications can cause dizziness and drowsiness and increase your risk of falls. These medications include both over-the-counter as well as prescription medications. Some over-the-counter examples are like Benadryl, which is an antihistamine, Gravol is an anti-nausea medication, and Zantac, which is a stomach pill. Some examples of prescription medications that increase your risk of dizziness and drowsiness are blood pressure medications like Ramipril, Diavan, or hydrochlorothiazide, sleeping pills, Zopiclone and Trazodone, and anxiety pills, Ativans, antidepressants, Celexa or Effexor, pain medications, codeine, Tylenol 1, Tylenol 2 and 3, tramadol or Tramacet, diabetes medications such as glyburide and insulin. You also need to watch out for some combination products that may contain one or more of these ingredients, such as all-in-one cough and cold medicine. Most of these products have an antihistamine that would make you dizzy and drowsy. So if you actually are only treating a cough, there is no need to take an all-in-one that would have an antihistamine that might make you drowsy and eventually fall. It's better to speak to your pharmacist if you're not sure which one to pick up, and mostly the pharmacist will be able to recommend the best product for you. Calcium is very important in our body to build bones, teeth, as well as other functions. But when there isn't enough calcium in our daily diet, our body uses up the reserve, and in that case, we might end up with osteoporosis or lack of calcium in our bones. It is recommended that anyone 50 years and older gets 1200 milligram of calcium per day. And the way to look at it is see how much calcium you're getting from your daily diet, a glass of milk, how much calcium is in, um, other food ingredients. And then if there isn't enough in your daily diet, then you need to probably take calcium tablets, which are available over the counter, and we'll cover that in the next slides. The recommended daily intake of calcium is the total of the combination of calcium from both diet and supplements. It is recommended to get as much calcium as you can from your diet, but if the recommended calcium intake cannot be taken from diet alone, then calcium supplement may be necessary. Two different types of calcium supplements are available: calcium carbonate and calcium citrate. So here we have a comparison between calcium carbonate and calcium citrate. As you can see on the left side, calcium carbonate has the highest amount of calcium per tablet, but calcium citrate has less amount of calcium per tablet. So you have 40% in the calcium carbonate tablet and 21% in the calcium citrate tablet. This means to get the same amount of calcium, you might end up needing 2 tablets of the citrate versus 1 tablet of the calcium carbonate. Calcium carbonate can be taken with a meal. Calcium citrate can be taken between meals. Calcium citrate is an alternative for people that have problems with the calcium carbonate, for example, constipation. Calcium has to be taken with lots of water. It is also recommended to take it throughout the day, and instead of taking one large dose, it is recommended to take no more than 500 milligrams of calcium at one time. Keep in mind that some multivitamins have also some calcium in them, which counts towards your daily calcium intake. So if you're taking a multivitamin, or if you're drinking a glass of milk a day, then you need to look at the amount of calcium in these two products and deduct it from your daily calcium intake, and then top it up with a calcium supplement. Vitamin D. Without vitamin D, we cannot absorb calcium. Vitamin D actually increases the calcium absorption by up to 80%. It does help build stronger bones by increasing the absorption of calcium from your digestive system. Vitamin D is also important to increase muscle functions. It is also a natural antidepressant. Vitamin D recommendations. 50 years and younger, the recommended daily intake of vitamin D is 400 to 1,000 units per day. 50 years and older, recommended daily intake is 800 to 2,000 units per day. So here are the key messages. Treatments are available to treat osteoporosis and reduce the risk of fractures. People respond differently to treatments, so there isn't a better treatment than the other. All available treatments reduce the risk of fractures from 30 to 70% depending on the individual response and adherence. For high-risk individuals, the benefits of drug outweigh the risk. Here are some quick examples of medications used to treat osteoporosis. We divide them into two categories. The one on the left up is the one that will slow bone erosion, and the one on the right is the one that will speed up bone building. The one on the left examples are biphosphonates, raloxifene, hormone therapy, calcitonin. The one on the right, the examples are parathyroid hormones. Biphosphonates, what they do actually is they bind to the cells of the bones and prevent degradation. They're available in a once a day pill, once a week, or even once a month, or even a yearly injection. The biphosphonates are not absorbed well in the body, and they have to be taken exactly as directed. They have to be taken not at the same time as your calcium, they have to be taken at separate times. Here are some examples of biphosphonates: alendronate and risedronate, the Actonol and the Actonol DR, and the Fosamax. Fosamax comes in a 10, 70 milligram. It also comes in a 70 milligram plus vitamin D. The Actonol comes in a 5, 35, and 150 milligram. Some more examples of biphosphonates: didrocal and zolidronate. How are these types of medications taken? They're usually taken on an empty stomach, first thing in the morning. You take them with a full glass of water, about 8 ounces, and it is recommended that you sit upright for about 30 minutes to prevent acid reflux. There are some other types of tablets that are delayed release, and these can be taken after breakfast as well. Some side effects include hypocalcemia, stomach upset, heartburn, nausea, muscle pain. Now, these side effects are very rare, but it is something to watch out for, and it is recommended to know the side effect of each medication in case it does happen. Then it is something to point out to your physician. Prolia is another option for treatment of osteoporosis, and it is usually second line of therapy after didrocal, or if there is a contraindication to the alendronate or didrocal or one of the biphosphonates. And what it does block the protein that breaks down the bone cells. Prolia is available in an injection that's usually injected sub-Q twice a year, and it is usually kept in the fridge. Some side effects, same as well, include hypocalcemia, skin reaction, and increased risk of infection. Here are some more examples of prescription medications. Selective estrogen receptor modulators. Raloxifene, Evista, is available in a 60 milligram tablets. Possible side effects include leg cramps, hot flashes, and increased risk of blood clots. Hormone therapies are only recommended as a first choice treatment if menopausal symptoms are present, like hot flashes or night sweats. They are available in estrogen or progesterone or as a combination. They increase the risk of breast cancer and stroke, and this usually have to be reassessed after 4 to 5 years. Parathyroid hormones are also another option. Examples are Forteo, and it's a sub-Q injection of 20 microgram for a maximum of 24 months in a lifetime. Now, here's an important question. Is my medication actually working? The problem here is that you can't really feel your bone density changing. So your physician will have a baseline bone density test done, and then will also be able to monitor how well your drug treatment is working by reviewing the result of your bone density scan. I'd also like to stress the fact that prevention is better than cure. So it is recommended to keep an eye on your daily intake of calcium and vitamin D, as we mentioned in the first few slides. The second important question is this the right medication for me? You and your physician will need to review the drug treatment options in relation to your bone loss and look at several treatment options, as every person responds differently to medication. And some people have side effects to one and not the other. Is this the right medication for me? We always look at cost drug plan coverage, which is always different from province to province. Look at the risk against the benefit. Treatment can always be changed, and we always try to find a drug treatment that works best for every individual. It is also important to be aware of the fact that adherence to dosing regimen is critical to encourage absorption and effectiveness. If a person chooses to discontinue, benefits will cease and bone loss may result. You need to go back to your physician. If there are side effects that cannot be tolerated, you need to speak to your pharmacist or physician. Monitoring treatment is critical. Thank you.